Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. This is update number 41. It's coming to you live on Friday, May 8th, 2020. I'm Steve Triffletti, a Plymouth Town Moderator, and we're here still each day, Monday through Friday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. And today, Ken, Matt, and I are joined by quite a panel. They include Dr. Barry Potvin. He is the Professor Emeritus at Yeshiva University, Department of Biology. Michael Botieri, he's the Plymouth Police Chief. Joseph McDonald, Plymouth County Sheriff. Laurence Pizer, Plymouth Town Clerk. Robert Eisenstein, Senior Planner. And Marie Oliva is the President and CEO, Cape Cod Canal Region Chamber. Each day we date stamp the corner top of the screen in order that you can see when it is a live broadcast. We're bringing you elected officials as well as experts in areas responding to the coronavirus. We're going to begin with the chair of the Plymouth Board of Selectmen, Kenneth Tavares. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. We have a very interesting panel today, and I'm very anxious to hear from each one of them. So my update is very short. Nothing extraordinary has taken place since we met yesterday. We're looking forward to the weekend, especially since it's Mother's Day weekend, and certainly keep encouraging our residents and visitors to observe all of the protocols that have been put out. Back to you, Steve.
Thanks, Kenneth Tavares. We're going to go to Dr. Barry Potvin. He is the Professor Emeritus from Yeshiva University. Welcome, Barry.
Yes, thanks, Steve. Thanks for having me on again. I thought I should start off by just saying, for those of you who may wonder, I'm still the Vice Chair of the Board of Health, but I'll be providing information mostly that relates to my background as an Emeritus Professor of Biology, who spent a lot of decades, more than I want to remember, teaching public health epidemiology and microbiology. So obviously, I have quite a few things in common with Dr. Mark Wilson. The topics I want to cover today include several things. They'll be brief. There are areas in the state and nationwide that seem to have a lot of coronavirus cases in comparison to other parts of the state. Usually, it includes those with high population densities, high levels of air pollution, high incidence of smoking and vaping, and high levels of obesity. These often also correlate with the presence of lower socioeconomic groups who live close together and suffer from poorer health care and lower incomes. There's also, as Matt well knows, clusters of cases that seem to be observed routinely in long-term care facilities, which are now being tested very actively by the National Guard. And also there's some of that going on among homeless populations as well. Another thing I wanted to mention is some seasonal concerns. Weather's getting warmer. As summertime increases, we're going to find more tick-borne diseases, such as Lyme disease and Eastern equine encephalitis. These are increasing because of the warmer, rainy winters and springs we've been having lately, as well as in the fall and spring, you'll get increases in influenza. The symptoms of Lyme disease include fever, chills, headache, fatigue, muscle and joint pain. Triple E patients have neurological complications as well as fever, chills, and vomiting. Everybody knows the symptoms of influenza. This may remind you of coronavirus symptoms. I thought of this because Dr. Triffletti yesterday mentioned his recent experience with a patient who already had a tick bite on his leg. And so obviously the patient probably was concerned whether it was caused by the tick or it was actually an infection of coronavirus. So what can you do? Obviously, you can be careful when you're outside this summer. Make sure you use insect repellents, long sleeves, and long pants when possible. And in the fall, make absolutely sure this year, especially, you get flu shots. September and October are the best times to do that. There's also been some confusion, I think, and lack of understanding about antibody testing. This is done usually with a drop of blood from a finger stick. The results are very quick. and it detects those who previously were exposed to the coronavirus, even if they had no symptoms. Reasons for doing this test: if positive, you must have previously been infected by the virus, usually within the last few weeks, and you could therefore have transmitted it to others who live with you or who you came in contact with, even if you yourself didn't know that you were sick. So it would be a good idea if they're identified that those individuals that came in contact with them also were tested. Also, doing this kind of testing gives you a much better estimate of the extent to which the infection has spread in the population. And this may allow some of the people that have tested positive to become convalescent blood serum donors to help others. Brookline is actually in the process of doing this kind of testing on May 15th, using 200 first responders and essential business workers, as well as 400 randomly selected residents. Today, also, there's been some news about progress with new vaccines for the coronavirus. Cambridge Biotech, is now known as Moderna, is now about to enter phase 2 testing of its messenger RNA vaccine. Probably will start early this summer. Ordinarily, this stage of testing of vaccines takes about 2 years, but in this case, it's probably going to take more than something like 3 to 4 months. If that goes well, there'll be another testing called phase 3, and then it's followed by production. There's 123 other vaccines being tested worldwide, and we can probably hope and expect vaccines, some of them at least, should go into production sometime in the first half of 2021. And that's just a matter of having enough vaccine and getting it administered to people. Finally, and this relates to the next speaker, the face mask orders. Many of you may have heard that there was a new state face mask order in public settings that was issued on May 1st. Previously, Plymouth issued its own. There are some differences, although they're very similar. The state order states that when you're unable to maintain a distance of approximately 6 feet from every other person, you shall cover your mouth and nose with a mask or cloth face covering. And masks are required at all times inside of grocery stores, pharmacies, retail stores, in taxis, any form of public transit, and in any kind of self-enclosed transit stop or waiting area. Most of those probably don't apply to Plymouth, but a lot of people worry about, why do I have to wear these masks when I'm out exercising or walking in public? The answer in Plymouth, at least, is that no, you don't, if you can maintain a 6-foot distance. But if you can't, you must wear a mask when you're doing those activities outdoors. We don't want to discourage people from doing these things outdoors. Certainly, exercising outdoors has many positive benefits. Among them, it actually improves your immune system's function. That doesn't replace the social distancing measures. I prefer to call them physical distancing measures. Also, you have to remain cognizant of washing your hands regularly with soap and water for at least 20 seconds, and definitely staying home when sick. The state order says that children under the age of 2 years should not wear face coverings or masks. And for children 2 to 5 years of age, they are encouraged to wear them, but it's strictly up to the discretion of the child's parent or guardian at the time. Anybody above the age of 5 has to conform with all of these various restrictions. There are some exceptions for those orders for face mask wearing. And the one that's most relevant to us is that those who are exercising outdoors and unable to keep physical distance from others. So this is going to also bring up what Chief Botieri is going to be talking about. There's a difference in the fines. So the state order indicates that any offense, the first will result in a warning. The second or subsequent offense can result in a civil citation or fine of up to $300. The Plymouth version simply states that a $300 fine will be assessed after a warning for improper disposal of masks or gloves in a way that shouldn't have been done. So there are some differences, but once again, the state rules and regulations take precedence over the local ones, unless the local ones are more severe. So as quickly as I could, that's a summary of the things I wanted to cover today, and pass it along to the next speaker. Thank you, Steve.
Is Dr. Barry Potvin. He is a professor emeritus at Yeshiva University. Yes, he's also the vice chair of the Plymouth Board of Health, but we're inviting him as an expert in the field of biology and epidemiology. We're going now to the Town of Plymouth Police Chief. We welcome back Chief Michael Botieri. Welcome, Mike.
Thank you very much, Steve. Thanks for having me. I appreciate it. Can you guys hear me?
Yes, you're coming in loud and clear.
So I want to take an opportunity to talk a little bit about some of the different rules and some of the enforcement and how that enforcement piece is going to work here in Plymouth. And I want to go over some of the things we've seen so far. Barry talked about a couple of things that I had on my list, but I'll kind of gloss over those. So I want to go back to the governor's order. One of the most important pieces that the governor put in the order was this group of no more than 10. And I think people need to realize that it says, while the order says indoor or outdoor, it specifies outdoor, an open space where you're not violating that number 10 if you are actually practicing social distancing. So we're getting a lot of calls here at the police department because they're driving down the waterfront and they're seeing a lot of a group of people that are together. And if that group of people is over 10, let's say it's 20 people, and they're practicing social distancing and they are not wearing a mask, that's not a violation. So we want people to know that. I think it's important that people realize that. If that group of 10 of 20 people is actually within the 6 feet, but are wearing some type of a face covering, once again, that's not a violation either. So we want to make sure that that people know that those violations, those are really not violations. And hopefully that'll kind of lessen the calls that we get. We really want to be part of the enforcement, but more education than anything else. So I want to make sure people realize that. The governor's order also allows the State Department of Public Health to issue guidances, and they've done that. And those guidances are ones you've seen, and I think we all have already know about, really more to do with grocery stores and those type of things. And as Barry mentioned, our local Board of Health has put a set of rules together, and he mentions appropriately that the governor's order takes precedent. You can have a local order that can be more restrictive, but not less restrictive than the state. We don't have any real issues with that now, although there are some very slight differences. We'll be be able to enforce both. So I want to talk a little bit about the Board of Health order. So the Board of Health order went out a few weeks ago, and it talks about all members of the public, and it talks about entering essential businesses, and including the workers in those businesses must wear masks. We have seen a little bit of that. We've had a couple of calls where people believe that they shouldn't be given an order by a local Board of Health or the governor to wear a face mask, that it's more their own right. We've done nothing but educate so far, and in conjunction with the Board of Health and the Board of Health agent, Karen Kuhn, and we've been 100% successful in educating right now. So moving on to the most recent order of the governors, and I think Barry just explained it very well. Ages 2 to 5 is recommended, but anyone over 5 must wear a face mask or a facial covering when in public. And I think that I want to focus on that again. You can't say that enough. That I think people stop there when they read it. They'd stop at the fact that you need to wear a face mask in public, and that's not what it's saying. It's saying, as Barry mentioned, if you're unable to social distance. So if someone is not social distancing, they must wear a mask in public. So someone walking by on the street that is not within 6 feet of someone else is not violating the rule. Some of the questions we see out there are family members. We know family members, you go home, you live together, I go home, I'm with my wife. It doesn't mean that my wife and I can walk down the street in public without face masks if we're within 6 feet of each other. There's no exemption for family members. It would be almost impossible for us to enforce or even kind of see the violation if that was the case. So I want to now key in on the enforcement piece. How does that work? The way the enforcement works for the governor's order, for his order, as well as the guidance from the state DPH and the local Board of Health, is, as Barry mentioned, it's a warning first, and then it gets into a potential $300 fine, which would be a local bylaw. But you need to realize that the language in the state order, as well as the local Board of Health order, talks about the authority lies with the Board of Health. The Board of Health has really all the authority in these matters, and they should. So the Board of Health and the Board of Health's agent, and if the Board of Health decided to increase the number of agents, they could clearly do that. There's a process for that. That's where the enforcement lies. It goes on to say that you, with the assistance when necessary of the state or municipal police. So we are in place and in line to assist them. So what we're seeing and what we're doing right now is we realize that it would be daunting and if not impossible for us to expect Karen Keene, one agent that the Board of Health has, to respond to all these calls. We'll handle the calls. We'll go to these situations. So I want to talk about a couple different situations and how we're handling those in conjunction with the Board of Health. So if we have a situation where there's a store in town and the violation could be the store itself violating the order or an actual patron. So if a patron comes in the store and just refuses to wear a mask and the store serves them and allows them to do that, the store's in violation because the store is supposed to have signage up and not allow people in the store without masks. The other way around would be that the store calls us because there are people in the store without a mask and they're refusing them any type of service and they refuse to leave. So in that case, the violation is the person without not wearing the mask. So in that case, what we're doing is we're going to write a report on that either way, and we're going to send that report and that information to Karen, to the Board of Health agent the next day, and in conjunction with her decision and her policies and guidelines and protocols that the Board of Health have put in, there'll be an enforcement action. If that enforcement action requires the police to go with Karen to assist, we'll do that. We stand ready to do that. Karen knows that, and we'll continue to do that. So we'll be ready to handle that. What we've done here in Plymouth, and I put an order out just yesterday, talking about the governor's order that began on Wednesday. We've decided, and what we're going to do, and I think most police chiefs throughout the Commonwealth, we're going to be really educating more than enforcing. So our primary goal is to educate people. And we've gone to the point where we really want to have the ability to even provide someone a mask. So should we go on a call where someone does not have a face covering, and during that discussion or that education, we find out the person doesn't have access to one. Now, we know you could use anything for a covering. You could use a bandana. But if we come across that, we have masks in our cruisers. Every cruiser now, they went in yesterday, we'll provide a mask to that person. That's how far we want to go. We want to assist people. We want to help them with complying with the rules. And we're looking for compliance, and we really feel confident we'll get that. I have really nothing to report as far as anything disruptive or any people not wanting to work with us. We're working in conjunction with the Board of Health. I'll be going to, on the video for the Board of Health meeting coming up next week. So I really just wanted to educate everyone on those factors. And if there's any questions later on in the show, I hope I can answer them. Thanks, Steve.
And thank you. That is Plymouth Police Chief Michael Botieri, who will stay here with all of our participants to answer your questions by emailing us at plymouthinfo@pactv.org. And at this time, we're going to now hear from one of Mike's business neighbors right next door, Plymouth County Sheriff Joseph McDonald. Welcome, Joe.
Thank you, Steve. Thank you for inviting me back onto the show. I have a few things to report today and perhaps some programs to remind people about. Our census has continued to decline here at the correctional facility as we speak today. The last time I was on, it was up at 674 individuals. That inmate population has dropped to 658. I know there was a lot of questions circulating with reference to testing. We're up to 42 tests in the facility, and we have had 2 inmates that tested positive. And it's important to note that both of those inmates originated from outside of the correctional facility, came to the correctional facility, presented with symptoms, or were in our isolation unit, did test positive, and are currently being treated and doing well within our medical unit. So that's a good positive thing. We have had 3 staff persons. One of those persons was early on and is fully recovered. And we had a correctional officer who also, when I was on last time, had tested positive. He also was quarantined at home, doing well and recovering. And we had one part-time person from our civil process office who also tested positive, but again, is home, recovering and in quarantine, doing well. Things here at the correctional facility continue to go very, very well. I think our numbers are very, very positive. This is really due in very large part to the great work that's being done by the staff down here, the medical staff, the correctional staff. We're very fortunate insofar as the quantity and quality of the personal protective equipment has dramatically improved. Masks, face shields, gowns, those types of things, they've increased. We're seeing that we have sufficient number of those to supply all of our population, our employees and the inmates as well. We've come a very long way from when we did not have sufficient supplies, and we're actually getting those cloth masks from our colleagues out in Springfield, which we appreciate. But it's a good news is that really all the sheriffs are able to do that now. Increased testing. I know a lot of people have questions about those things. The testing here at the correctional facility will continue in accordance with the CDC and DPH guidelines, which is individuals that are presenting symptomatically will be tested and dealt with appropriately based upon the results of those tests. And we've talked about those already. One of the things that I did want to mention that people may or may not be aware of or even thinking about, I know in this time of isolation, there are many of us, myself included, who have relatives who live some distance but still within the county. You can't always get over to check in on them as much as you might like to. I want to remind everybody about our safety assurance program. That's a free service that we offer here through the sheriff's office. People can call this office and sign up for that. It's a totally free program. And what it does, it's an automated phone call that we make to these individuals who are home, oftentimes without the contact that normally they would have. And basically checking to see if those individuals are okay. If the phone is answered, they're okay, not a problem. If there is an issue, we would be alerted to that. And there's a list of people that the individuals themselves provide that we would contact to let them know that they needed to check in on that person, and we'll take it from there. So things here at the correctional facility are going very, very well. Again, I credit two things: the great hard work of the men and women that work down here, and the grace of God. So thank you for having me, and then happy to hear any questions. Thank you.
Thank you. That is Plymouth County Sheriff Joseph McDonald. He'll be here for your questions. Email us at plymouthinfo@pactv.org. We welcome back our town clerk, Laurence Pizer, now that the state has acted with keeping the elections as scheduled. Larry, what can you update us with today?
Well, you mentioned that the election will occur on May 19th, and the town of Plymouth will participate. I want to thank the select board for acting valiantly in trying to do what is right to move it. I am very disappointed in the Senate for not following their request. Even more disappointed in the Secretary of the Commonwealth, who doesn't know that Plymouth knows how to run an election under all circumstances. We do. You'll find that your opportunity to participate in the election is absolute. I am, again, asking everyone who possibly can to vote by mail. You can find an application on our website. You don't even need an application. You simply need a request with your signature on it, and get it to the clerk's office as soon as possible. My staff is working as hard as they possibly can to get the forms out. Some people have asked, what if I request a form by mail and it doesn't arrive? We'll send it out. We can't guarantee what happens to it once it hits the mail, but if it doesn't arrive, just because you requested the form doesn't mean you don't have the right to go to the polls. We hope that you will get your form. We hope that there won't be any need for you to go to the polls. If you do go to the polls, there are some things that we're also strongly suggesting. First of all, if you possibly can, leave your children home. We are limiting the number of people, the number of voters and non-staff members in the polls to 6 at any one time. Having children there takes up one of those people. It will just slow the process down. Also, please wear a mask. Just do it. Bring gloves. bring a pen. You will notice when you get there that we will have a smaller staff. We also have to socially distance with our staff members. My staff has been going far above and beyond, and they will also be doing that on election day. I understand that elections are very much this is when it is, and you can't do anything once it's over. So let me give you my phone number. It actually rings on my cell phone when I'm not in the office. It's 508-322-3302. If you have any questions before the election, during the election, give me a call. As far as what do you do once you get the ballot? Well, for those of you who have the ballot within the time to mail it back to the clerk's office, that's clearly the best way of doing that. If you don't, and if you want to feel confident that it's going to get back to us, there is the deposit slot at the upper entrance to Town Hall to the left of the doors, and you can put your ballot in that slot. You might have to fold it, but it will go in. We are going to have an election. We are going to have results, even as we're disappointed that it's unnecessarily endangering people. Thank you, Steve.
Town Clerk Laurence Pizer. He can answer your questions at PlymouthInfo@pactv.org. Once again this week, we also welcome back Robert Eisenstein. He is a senior planner. Welcome, Bob.
Thank you, Steve. Can you hear me okay?
Yes, we can.
All right. So there's been a lot of discussion about the testing that's going on in the nursing homes. And before I get to the numbers, I just wanted to explain a little bit about the history of how we've come to do testing in such a high percentage of the nursing homes. Two things are driving this. The good news is that I think tracking the phase of this virus, we're sort of gone through the surge phase at the acute hospital level. And the good news there is many of those folks who were positive are being discharged home, but some of those are being discharged back to nursing homes. So I think the phase that we're in now, the best way to describe this is if you think of it sort of the surge of patients who are positive literally are now residing in our senior living facilities. And just a reminder to everybody, that includes not only nursing homes, it includes things like rest homes, independent living, assisted living, group homes. So if you think of any residential setting where our elders are living, and that's a large number, there's a total of 680 facilities across the state. And the efforts, thanks to the governor's office on down to Department of Public Health, and Dr. Potvin mentioned the National Guard as well, we've tested 604 facilities for over 35,000 residents. That's an amazing number. That's the good news. The flip side of that, as everybody knows, unfortunately, the more testing you do, the more positive cases you're going to uncover. And so what's happened now in nursing homes, on average, a ballpark number, almost, I think there's a positive case in just about every nursing home in the state. What happens is they're going to get anywhere from 20, as high as in some cases 50% of that population will come back with a positive corona test. So the trick is, and I wanted to mention, in addition to the National Guard, what's unique about Massachusetts is we've actually trained the nursing staff in the facilities. It's their choice. They can bring in the National Guard, or they can train their staff on the nasal swabs to do their own testing, because some folks are still a little nervous about having outside people come in. So there is a large number of tests going on right now. And what's happened at the facility level, the Department of Public Health, as of April 30th, put into place something called the COVID. We refer to it as the COVID 28-point questionnaire. Every administrator in every nursing home had to send in a self-assessment and an attestation summarizing the number of positives in their building, and they had to fill out a checklist on it. It's actually a competency checklist, so that we can determine which nursing homes might need help in sort of upping their game to deal with the coronavirus. So it's really been a tale of two cities. I mean, the death rate, which we've talked about before, unfortunately, percentage-wise, of the elders in all the senior living is about 60% of all of the deaths statewide, which makes sense, but it's a really difficult number when you're talking to the folks. And I think I mentioned this before. The staff in the nursing homes just deserve so much credit. These people have been exhausted. They're dealing. So for every positive patient that we have, you can imagine it impacts the staff. And there are criteria now for staff who have to be quarantined. If someone even is asymptomatic but they've been exposed, they have to go out for 7 to 10 days. Someone who is positive has to be quarantined for 14 days. So there's a number of efforts that the state is doing right now to take care of testing. As I said earlier, there's something called pay for performance, which interestingly enough has always been in hospitals, and now we're moving it into nursing homes. So if they could comply with this 28-point questionnaire and prove that they're really doing a good job in competency, the governor has set aside some additional funding under Medicaid for them to actually get more funds in order to treat their patients. So it's a terrific program. And just to point out quickly, because I know we're short on time, a couple of the things that are on that questionnaire, for example, PPE, the nursing homes and the senior care facilities have to prove that they have at least a 2-week supply of protective patient equipment. If they don't, they can call the command center at the state to get deliveries to come in. Cohorting, they have to be trained on how to separate all the positive cases, as well as maintaining the safety of the non-positive cases. We call it musical beds because there's a lot of activity going on in nursing homes on a daily basis. Congregate spaces have to be closed. We've talked about that before. Everybody knows that visitation is still being restricted. And then, of course, if there is a positive case identified, the state is coming out to audit facilities, and they've redeployed the entire Department of Public Health survey team. They've waived all of the regular surveys, and they're now just focusing on a COVID audit. Every 2 weeks, and in some cases every 4 weeks, every nursing home in the state will have an audit by the Department of Public Health team, and they will be scored on this 28-point checklist. And then based on those results, they may or may not have a return visit. One of the other things that's happened in senior living is something called an infection control preventionist, which is a new position and there's a special certification just on COVID to know how to take extra precautions, things like donning and doffing PPE, for example. So we have several nurses who are certified in that. And then lastly, and then we'll move on, there are, in addition to the National Guard who are being deployed into the senior living facilities, we also have something called the Rapid Response Team. And I think I mentioned this last week. There are actually 4 areas of the state, Framingham, Springfield, Woburn, and Braintree. And there are teams of 8 to 10 nurses and CNAs that are going out to the hotspots, those nursing homes that really need staffing help. Because as I've mentioned, once the increase in, it's a double-edged sword, you have an increase in positive cases, you also unfortunately at times have staff that have to, leave the facility. So I'd say staffing right now is the biggest challenge that we're having right now in the nursing home. So these rapid response teams are able to go out and help out from 2 to 5 days to take over staffing for them. If anybody has any questions, there's a lot of activity going on, and I'm very proud of the testing capability in Massachusetts. We're going to hit 100% of all residents being tested very soon. So thank you very much, Steve.
Thank you, Robert Eisenstein. He is a senior planner from Plymouth. Bob will be here to answer your questions. PlymouthInfo@pactv.org. And now we welcome in our business segment, once again, Marie Oliva will be joining us. She is the president and CEO for the Cape Cod Canal Region Chamber. Welcome, Marie.
Hi there. I just lost electricity in my office, so excuse the dark background. I'm Marie Oliva.
You're loud and clear, though. You're great. You look great.
Okay, yeah, I'm sorry about that. We just must have lost power.
Live TV.
Okay, Marie Oliva from the Cape Cod Canal Region Chamber of Commerce. What I wanted to mention, which is really quite important, is that the governor has a reopening advisory board. And I think it's critical that businesses respond directly to the task force. The task force is going to be making recommendations directly to the governor by or before May 18th. On May 18th, the governor will be coming out with some of the recommendations from the reopening advisory board. If you just Google the governor's reopening advisory board, you can fill out an online form to communicate directly to the board that will make recommendations. Now, on May 18th, it's not going to be a magic bullet. When they reopen businesses, it's going to be a phased approach. So it's not like it's going to happen right away, that they're going to be opening retail and restaurants right away. It depends on whether you're an essential or non-essential business. Also, the Cape Cod Reopening Task Force was just formed a few days ago from the legislature, and they will also be taking recommendations online throughout the Cape. They want to be able to have continuity in the guidelines. For example, the governor comes out with guidelines, then different cities and towns come up with their own guidelines, which can be more restrictive. What the Cape is trying to do is to make sure that the guidelines are somewhat consistent and all, so it doesn't confuse some of the businesses. For example, if you drive from town to town, somebody might be open, somebody might not be open. So that's the purpose of these two task forces. Also, what the businesses can do is to contact their organizations that they're a member of, such as the Associated Industry of Massachusetts, that's called AIM, AIM. Then there's the Massachusetts Restaurant Association, if you're a member of that, MRA. And if you are a member of the Retailers Association of Massachusetts, that's RAM. They come out with all different kinds of guidelines. They can update you immediately on what the governor's information is. And they're there. You just make a phone call and they can help you. And also you can call the Cape Cod Canal Region Chamber of Commerce. We're open for business as well. What I mentioned about the guidelines being consistent, because it's quite confusing out there. So that's why they came out with these boards and task forces to help you with that. Lastly, I want to mention the Paycheck Protection Act, the Paycheck Protection Program, PPP. That's business. A lot of businesses know that. A lot of seasonal businesses don't know when to call back their employees, and the payroll is tied to the PPP program. 75% of that loan is tied to payroll, and the loan can only be forgiven if you bring back your employees. A lot of times the employees are doing better with the generous unemployment benefits. And what that means is that some of them might not want to return. So therefore you're having trouble planning on who can you call back and who can you come in to open up your business. If you don't know when you're going to open up your business, then they might lose the PPP loan. So that's something at the federal level that has to be addressed. Also, the Small Business Association is now taking applications for the EIDL program, which is the Economic Injury Disaster Loan. That also can be forgiven. And they weren't taking applications as about a week ago because they were inundated with information. So now they are taking applications, and I urge businesses to check out the PPP program and the EIDL. Lastly, I just want to talk a little bit about the replacement of the Sagamore bridges. We're inching closer and closer. There's a bill in Congress now to direct the Army Corps of Engineers who own the bridges to make it priority funding, which is important because the U.S. Army Corps of Engineers has tons of projects throughout the United States, and you have to move that up on the list. So that's something that is progressing and moving forward. So with that, I appreciate the opportunity, Steve, to be on your show very much. Thank you.
Thank you, Marie Oliva. She is the president and CEO of the Cape Cod Canal Region Chamber. She is our business segment today. She'll be here to answer your questions. PlymouthInfo@pactv.org. We now go to Plymouth State Representative Mathew Muratore. Welcome, Matt.
Hey, Steve, how are you today?
Good.
Okay, so let's look at some numbers real quick. We had increased testing from the day before of 11,993, so almost 12,000 more tests from the day before to 351,632. So 5% of the Commonwealth residents have been tested to date. With that, we see an increase of 1,696 cases of folks who have been confirmed with the coronavirus. And that's 14% of those that were tested yesterday. So that number's another good number. The numbers are still staying down. So the total confirmed cases are 73,721, or 21% of those tested have been confirmed with coronavirus. As Bob indicated, the amount of deaths are 60% have come from long-term care facilities, which again are nursing homes, assisted livings, and rest homes. And we've had a total amount of deaths so far of 4,552. And unfortunately, there were another 132 that passed away yesterday. So that's 6% of those that have contacted the virus have passed away. And as I've said before, that 95% of those that have passed away have all been over the age of 60 years old. With regards to Plymouth County has a 6,081 confirmed cases. That's up from 182 from yesterday, with 364 total deaths, an increase of 7 from the day before. And the town of Plymouth has 319 confirmed cases. That's up 3 from yesterday, or from the day before, and that's total deaths of 9. And again, all 9 deaths in Plymouth have been from long-term care facilities. With regard to hospitalization, the ICU numbers have gone down. So hospitalizations still remain at 5%. The total number of ICU beds dropped by 70 beds from the day before. We're now at 852 patients that are in the ICU in hospitals throughout the Commonwealth. And in hospitals, overall, those are in the hospital with the coronavirus is 3,436. That's down 126 from the day before. The average age of those that are in the hospital is still 68 years old. The amount of open beds in Southeast Massachusetts for hospitals has dropped slightly. It's at 43%. If you recall, we've been running over 50%. So this area, the South Coast, South Shore area is in the surge at this point. Still plenty of capacity. There's still 43% of beds are open in hospitals in the Southeast area. And in Massachusetts, that's 51% of the beds are still open as well. BID Plymouth has still seen an increase of COVID cases. They are at 74 today, with 9 in the ICU. So that's still increasing. A lot of it is also due to testing as well. More testing is being done, so you are going to see some more cases happening as well. With regard to unemployment, I know we touched upon this yesterday, but just want to reiterate that we have 24% of the folks, labor workforce in Massachusetts on unemployment at this point. That's 963,000 folks who have filed for unemployment since March 15th. So as Marie was talking about getting back to the recovery of the economy, I had a conference call with Secretary Canal yesterday, who's the Secretary of Economic Development and Housing. And his committee, along with Lieutenant Governor, working feverishly with so many different industries and getting input on how to safely open the economy. And they're going to use data and not dates to do it. So it's going to be these pieces of information that we talk about daily on these stats on how they're going to actually safely open the economy. And again, it's not going to open all at once. It's going to open slowly, but it's being open with input from all the industries throughout the Commonwealth. And one of the issues that did come up yesterday that people seem to be concerned about is childcare. As the economy opens, how are they going to get childcare? The governor has an order in place at this point that June 29th is when child daycares can actually open, but emergency child care centers are still open. So they are working on that. The advisory committee is working on child cares with regard to all industries that are going to be opening. So they are well aware of that, that there will be some child care needs that will need to happen. With regard to yesterday's conference meeting with the governor, and by the way, the governor will be on today at 2:30. A lot of it had to do with folks that have been confirmed with coronavirus. You are getting calls, and if you get calls and the area code is 833 or 857, and it says COVID MA team, then please pick up on that. They are looking to trace the contact of how you actually received it, and they're going to call the people that you've been in contact with as well. So far, they've been able to reach out of the 73,000 individuals who have been positive for coronavirus. they've reached out to 14,000 people and been able to talk to another 7,500 who've been close contact with those folks. However, 50% of the people are not answering their phone. So if you do get a call, please answer it. It could be from the local Board of Health as well. They will never ask for your Social Security number or any sort of credit card or anything like that. So don't worry about that. But if you do get a call like that and they look at the Social Security numbers or a credit card, please don't give them that information. That's not what this is about. But it's important that that this tracing occur, that the testing occur. One thing Bob was talking about in the long-term care facilities, they're not, even though they'll be finishing up probably next week testing every single nursing home, assisted living, and rest home in the Commonwealth probably by the end of next week. There'll be a second round of testing that will continue in these facilities because we know these are hot spots. We know this can come back. We know that people can have the coronavirus and not have symptoms and could be passing along. And as we talked from the statistics, that 95% of these people are over the age of 60 that are passing away. So we really need to protect this vulnerable population, and we will continue to do that. But it's important that folks answer the phone for the tracing. It's vital to protecting the health as we continue to open up the economy. So, and these will be happening for some time to come. The tracing, the testing, et cetera. That will be our new norm. So please help out in any way you can. It was just announced this morning the Mass Fisheries Association, the Mass Fisheries industry, is getting a $28 million grant from the federal government. So that's good for the fishing industry. More details on that will be coming out. With regard to the Conchella, I know Amy Naples she's actually interviewing on Channel 5 as we speak to talk about Conchella that's coming up this Saturday, tomorrow from 7 to 10, PAC TV. Thank you so much for covering this. But check that out tomorrow night at 7 p.m. And one last reminder about the federal census. Please go to 2020census.gov and fill out your census. It only takes a couple of minutes to do. But it's important. I think Mike Jackman from Congressman Keating's office the other day indicated that Plymouth is at 50% or 57%. That's good, but we need to do better. We need to continue with that. I know the League of Women Voters in Plymouth is going to be doing a campaign to really help get people out to actually get their census done. So if you can please do that online, again, by 2020census.gov, sooner than later, that would be greatly appreciated. And that is the update for today, Steve.
Thank you. That is Plymouth Representative Mathew Muratore with his opening statement. Looking to Monday, Matt, Ken, and I will be joined by Sarah Cloud, and she is the behavioral director of behavioral services at Beth Israel Deaconess here in Plymouth. Also, our business segment will be joined by Amy Naples, and she's from the Plymouth Area Chamber of Commerce. We're now going to go to our questions. Our first question is for Selectman Chair Kenneth Tavares. Ken, a viewer writes, his name is Arnie, and he asks that he is the owner of a fairly large commercial property in Plymouth that is currently closed. They're suffering great economic loss, and he's wondering whether the Board of Selectmen will be giving any consideration to businesses when they set the tax rate for real estate taxes.
The board does not have the power to adjust anyone's individual tax rate. But I can say to Arnie that there is additional time to pay. I know he sent this question in late last night, so I'm happy to have the opportunity to respond to him on the program. You have everyone in the town, business and individual, have until the 29th of June to pay their taxes without penalty or interest. There are programs that there can be adjustments and abatements to taxes, but they would have to sit down with someone from the assessing office and go into detail as to whether they would be able to apply for them. But the quick answer is no, we cannot forgive the taxes or give special treatment, but there are programs available to lessen the impact for this tax period.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen, answering a question from viewer Arnie. Our next question is going to go to the police chief, followed by Dr. Potvin, and it has to do with masks. Chief Botieri, you indicated that a store owner could be violating the rule if the store owner allows someone to be at the store without a mask. The viewer asks, what about office building owners or landlords in an office building where the common areas are areas where people should be wearing masks? What is the responsibility or liability, if any, of a property owner, landlord, or possibly an absentee landlord?
So, Steve, you're talking about maybe an office space that is not open to the public, that type of an area?
Well, this would be an office space that might not be open to the public, but the building itself is open to the public, and therefore people enter the building in order to access the offices, and there are common areas. And the viewer understands that the common areas are areas where masks should be worn.
Yeah, I think Barry will be able to answer that even better, but I think the local Board of Health order talks about commercial buildings that have more than 2 units. And because of that, they need to wear facial coverings whenever they're going to be within 6 feet. So I would defer that to Barry.
Dr. Barry Potvin, could you further respond?
I'll try. As far as the Plymouth Board of Health order goes, if it's a residential business that has more than 2 units within it, it is the responsibility of people entering common areas to make sure that they are wearing masks. I'm not sure what the liability would be for landlords or absentee owners, but I think the primary requirement would be for the people entering to observe the masks.
Thank you. Next question to Robert Eisenstein, our Plymouth senior planner. And Bob, the viewer writes that we mentioned nursing homes are being tested. Will people who live in senior housing also be tested?
Which type of senior housing? Just regular apartments? 'Cause
They're
that
not
would- that would-
specific, but it would appear that they're
Yeah.
talking about public senior housing, such as we have in Plymouth.
Yeah, so for public senior housing, I'd probably defer again to Barry or perhaps Matt or the chief. I can tell you for the licensed facilities, independent living, assisted living, nursing homes, anybody, the rule is anybody that's accepting funding from the state, those are doing testing. As far as the public housing in Plymouth, I would defer to my esteemed panel to answer that.
Thank you. We're going to go to Representative Mathew Muratore. Matt, further responding?
Yeah, that actually came up on the call yesterday with Secretary Keneally with regard to public housing, and the answer is it depends. These are independent people living, so it's not like as Bob indicated a licensed facility at all. So there's not a rush to go into facilities like this, but if there's a need, then they would be like any other home where they would contact their local PCP. The primary care provider, and see if they qualify for testing.
Thank you, Representative Mathew Muratore. Each day we go back to our panel for a wrap-up, a takeaway. They've all heard each other talk, and I'm going to begin in order with Dr. Barry Potvin. What do you want us to remember today?
I think we have to remember that this is a new normal. It's been discussed before. This is going to go on probably until we have a antibody that can be widely disseminated, until herd immunity is achieved. Beyond that, you have to remember that we're really in a position now where we have to be very careful, not just for ourselves, but for others. And so it's not really about me or you, it's really about everyone else. And we have to be very patient, very perseverant, and very conscious of everybody else as we get through this. Thank you, Steve.
Thank you. Chief Michael Botieri from the Plymouth Police Department. What's your takeaway today for today's viewers? Unmute yourself, Mike, please. All right. Chief Michael Botieri from the town of Plymouth.
I think I have it. Am I all set?
Yes, we're all set. Go ahead.
Oh, sorry about that. Yeah, I would just want to end by saying, we encourage everyone to follow the rules, follow the orders of the governor, the Department of Public Health, and the local board. And, just ask that we're taking on the philosophy in the policing piece to educate, over enforce, and, please, there's no need to put an officer in a position where they even have to make that decision. So please work with us. We stand ready to work with all the citizens of Plymouth, and we appreciate the time. Thanks, Steve.
Thank you, Chief Michael Botieri. Going to go to Plymouth County Sheriff Joseph McDonald. Joe, provide us with a lot of good information. What should viewers take away today?
Thank you, Steve. I think what viewers should take away today is that things are going well down here at the correctional facility. I know there were a lot of individuals out in the community that were predicting, terrible things in all correctional facilities, and it's happened in some. But we've been very, very blessed here in Plymouth to have avoided really the tip of the spear here, if you will, with the reference to the infections. Things are going well. Again, it's due to the hard work of our staff, the correctional staff, the medical staff. And I would be remiss if I didn't mention and give a shout out to our corrections officers. This, you may or may not be aware, is Corrections Officer Appreciation Week. So thank you to them. And ironically, also happens to be Nurses Appreciation Week. So my thanks to both of those groups. I do want to make one comment, reiterate that if anybody thinks they might be able to, or they know somebody that might be able to make use of our safety assurance program, please feel free. You can look on our website. You can check that out. If you have questions, you can call us. And again, it's a free program. And for those individuals who can't get out to check on their loved ones or their friends, it's a great program and something, as I said, it's totally free. We're here and we appreciate the opportunity. Thank you.
Thank you. Plymouth County Sheriff Joseph McDonald, Town Clerk Laurence Pizer. We have 2 elections coming up. What should our viewers remember?
3 words: vote by mail.
Thank you, Town Clerk Laurence Pizer. Words to live by in many respects. We're going to go to Robert Eisenstein. He is a senior planning consultant from Plymouth. Bob, what can you add?
Well, I have a few more than 3 words, but two parts. I think, unfortunately, as we saw in the general population and hospitals where there was a surge, we are going to see that in nursing homes because we're doing more testing. So I think we all need to be prepared for an increase in positive cases, increase in death rate, et cetera. That's the bad news. The good news, I've seen a tremendous increase in coordination and cooperation between the state level, the local level, Department of Public Health. And I think once the dust settles, we'll be much better prepared in nursing homes to treat infections going forward. And I would also like to give a quick shout out to all the nurses who are working just so hard, not just in nursing homes, but across the healthcare setting. My wife is a nurse too, so thank a nurse today. Give them a remote hug, like a fist bump or something.
Thank you, Bob. And I'll take this opportunity to thank my niece, Diana Triffletti, who is also an emergency room nurse. At this time, we're going to go to Marie Oliva. Marie, what do you want viewers to remember today?
Sure. I want to thank you for the opportunity again, Steve. I want businesses to be proactive and to go to the governor's reopening advisory board. The form online is very simple to fill out. They need to hear from you. If you want a voice and you want to reopen, go to that board.
Thank you, Marie.
Thank you.
Marie Oliva. She is the president and CEO for the Cape Cod Canal Region Chamber. And each day we do wrap up with our Plymouth State Representative, Mathew Muratore. Matt?
Yeah, great panel today, as usual. As Maria said, absolutely. That was one of the takeaways yesterday from our meeting with Secretary Keneally as well, to have people go online. So I'm glad, Maria, you brought that up. Your voice is very much needed and requested. But remember that there are going to be new norms, as Barry was talking about. There are going to be a lot more cleaning that's going to have to be done. There are going to be masks that are going to have to be worn. There's going to be gloves that have to be worn. There's going to be social distancing that's going to have to be done no matter where you're going to be. And please don't expect that on May 18th, the light's going to go on and everything goes back to normal. It's not going to be the case. It's going to be a slow opening. It's going to be based on data and not dates. Please let your voice be heard on how you can safely do it. One of the things Secretary Keneally indicated yesterday was that many businesses that are coming forward to the panel are already thinking ahead of how they can actually plan ahead and do this. It's terrific that people are thinking this way and businesses thinking this way. So we appreciate that. Larry, just so you can see, here are my wife's and my letters that we did this morning. Very simple to do. It's very simple. You just type it out, sign it. I took a picture of it and I sent it to Miss Reardon this morning. So I'm looking forward to getting my absentee ballot. So thank you for that reminder, Larry. Appreciate that. Bob, we thank you for what you're doing in the nursing and assisted living and home industry. It's going to be a new norm there as well. It's been underfunded for so many years now, and unfortunately, it's catching up to the long-term care industry, the underfunding that's been going on. But I think the funding will now, need to start, and God bless all those healthcare workers that are working in these facilities. So we really appreciate that, and we thank Chief Botieri and Sheriff McDonald's for what all your teams are doing to keep us all safe, keep us all from physical distancing and keeping our population, whether it's inmates or whether it's outside, safe and fine. With that, again, remember that Concello is this Saturday, tomorrow from 7 to 10 on PAC TV. I'm sure you'll see it out on social media. So please go on and watch that and be part of that. And remember that we need to thank all those essential healthcare workers that are taking care of our physical health and those that are taking care of our economic health and keep them in mind. You want to make sure that we stay informed. Continue to stay informed. We're getting there, but we're not there yet. So stay informed by going to mass.gov/COVID-19. If you have questions, call 211. If you have, you want to get text alerts, which is the best way to do this, go to COVID MA, 888-777, or in Spanish, COVID MA ESP to 888-777. If you have questions on your health, it's bowiehealth.com/mass. Again, stay home, stay calm, and remember, the more we come together by staying apart, the quicker we'll get back to the people we love and the things we love to do. Thanks again, Steve. Thanks again, PAC TV, and happy Mother's Day to all the mothers out there.
Thank you,
We'll
Plymouth State Representative Mathew Muratore. Thanks to all members of our panel, Dr. Barry Potvin, Plymouth Police Chief, Michael Botieri, Plymouth County Sheriff, Joseph McDonald, Plymouth Town Clerk, Laurence Pizer. Robert Eisenstein is a Plymouth Senior Planning Consultant, and Marie Oliva is the President and CEO, Cape Cod Canal Region Chamber. And we now circle back, as we do each day, to the Plymouth Board of Selectmen Chair, Ken Tavares. Ken.
Thank you, Steve. On behalf of the Board of Selectmen, I want to wish all of the mothers out there a happy Mother's Day and hope that you have some time for yourself this weekend, as I recommend that each Friday to all of you, to take some time for yourself and recharge and become renewed. Also, I want to thank the panelists today. They were extraordinary. I am particularly appreciative of those that represent the town of Plymouth. Each day on the panel, there are many, many people that are giving their time and coming in to update us on many issues. The only thought that I can really put as to what we're going through is that change is now going to be the only constant. And I think that we need to be prepared for that. We need to be understanding of it, as other panelists have even mentioned today. Together, we can do this. Thank you. Have a good weekend, and we'll be back with you on Monday.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen. And on Monday, we'll be joined by Amy Naples, the Executive Director, Plymouth Area Chamber of Commerce, and also Sarah Cloud. She's the Director of Behavioral Health and Social Work at Beth Israel Deaconess in Plymouth. Again, we want to thank all of the nurses and all of the people who are working at our hospitals, at our doctors' offices, who are supporting us. Again, thank you to all the mothers who are going to be celebrating Mother's Day on Sunday. Special shout out to my wife Noelle, and also to Emily, who is a mother-to-be with our first grandchild. So happy Mother's Day to everyone. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.